Hello, everyone. I see there's some transition happening. So I couldn't be more excited to be a part of this panel. As she mentioned, have a human rights firm, and I've worked in close to 50 countries at this point. And so the opportunity during a week like this in San Francisco, where we hear so much about very specific solutions to very specific problems, I love this opportunity to take a big step back and give patients a voice literally all over the world. And everyone in this room knows that, starting a company is hard enough. Being a successful entrepreneur in healthcare is near impossible. And these three individuals have managed to do that across borders, across cultures, languages, and in some cases, across continents. And so I think we have a lot to learn from them. So I want to jump right in. And I want to start broad, especially given the theme this year. You're all working on different moonshots, but at the end of the day, you're all focused on improving access. And could be a handheld device, it could be working with clinics. So I want to ask you, in your regions, what does collaboration look like? And I'll start with you, Javier.
Sure. Well, in Latin America, collaboration is key to get this rolling. Access problem in our region is so huge. For people, it can take from a day to a week to just talk to a doctor, and it is really expensive for most of us. Another significant data is only 5% of the people are able to afford private insurance. So for us, collaboration, 5 years ago when we started, was trying to align all those players that have some interest in fixing this problem in some way or another. So by aligning the goals, we've been able to work with health insurance companies because they're trying to save costs but also grow their markets. Providers, because they need more efficiency, because we don't, in Latin America, also have enough providers. Government, because the space is sometimes gray and regulation is not there. And with so many other institutions that are basically trying to fix a problem, having a person in the center. So in our case, at UNDOC3, we don't talk about patients, we talk about users. We try to provide a user experience for them so they can, at any time, be able to talk to a doctor just by using their phone, just chatting with the doctor, in the middle having AI to optimize doctor's time and some other resources that are not only provided by us, but so many players.
And what about you? What's collaboration look like?
That's a good question, Nicole. So I'm from Southeast Asia, and heart disease is still the #1 killer of both men and women. And it really pains me as a cardiologist because we do have the medications to treat it if we could just detect it early enough. Not just that, but in Southeast Asia, everyone's getting the heart disease, even heart failure, at least a decade early. And so there's plenty of time to really intervene if only there was access to the detection of heart disease. And so collaboration involves, I think, 3 partners to me. One is the doctor, who will embrace, please, decision support and technology to help us do this better. Secondly would be health systems. And health systems really have to start thinking about going upstream, about preventive care, about predictive analytics based on what we can see. And then the third actually is big pharma. Because big pharma have the drugs. They're not being implemented, especially in places in Southeast Asia like Indonesia, Thailand, and I could go on. So
Interesting.
Hi. We've taken collaboration in a very different way when we decided to build Clinivantage as a company. And we've seen collaboration means different things across different continents because we operate on 3 different continents today. For us, the core of our ecosystem was to bring different players, different healthcare players, different family members together to actually solve the problem. And I'll give an example. We're working in rural health sector in India, and we've done 60,000 outpatient care sessions at a cost of less than $1 each. Now, this wasn't possible if we didn't have the right payer mechanism, if we didn't have the right doctors, we didn't have the right health workers, we didn't have the right family members, and if we didn't have the right technology. So what we've done is we've taken every aspect of what it takes to deliver care and timely care. So, what was an important part of what we did in terms of collaboration was not just to identify that the last mile care is required, but actually how do you get it in time and how the interventions are done in time. And that was the biggest difference we saw is when we talk about collaboration is about getting different aspects of the care delivery mechanism.
So maybe you could give a tangible example. So, you mentioned pharma, and so those are very different than some of the on-the-ground, small clinic-type collaborations. I mean, those are still very structured and rigid, like we think here in the US. So can you give us each an example of someone you collaborate with?
Well, I'd love to give a vivid picture of this. So picture maybe not so much structure, but a mobile bus almost, going out with nurses who may not be medically trained in ultrasound of the heart or echo, which is what we do, but equipped with the AI and with the handheld tools to be able to screen patients in the community. And health systems then identifying those patients, giving preventive care, and all supported by pharma who actually have the drugs that can effectively prevent heart disease in these patients. And the reason for involving pharma is, they too need a way to implement and get the drugs to the right people. And so that would be one moonshot dream of ours, to actually put our AI on handhelds, enabling echocardiography, which is really the safest, commonest tool that cardiologists use to screen heart disease, enabling that to be just democratized and really put even in the hands of untrained persons.
So I have a great example to talk about this, the kind of work that we're doing if we focus on public health in the country of Bangladesh and in India, is really about empowering the clinics, empowering the health workers. We are talking about a small clinic in a 10 by 10 setting. And if you look at the technology in terms of hardware, we've got enough hardware that actually will let you do last mile diagnostics. Things that used to take 1 or 2 trips to a doctor, maybe a couple of days, 24 hours to 48 hours to get the results, can be done within 30 minutes. So we actually deployed health ATMs along with our devices and our technology platform to let the health worker actually do the last mile diagnostics, push the data back to the district hospital where you have the doctor who's a specialist actually consulting with the patient in real time. So what we've done is we've actually used technology to bring doctors into the homes or into the villages and districts. And that's a big shift in terms of what Dr. David was talking about a while ago, is how do you change the ecosystem where you bring care into the homes. I think technology is there. We've seen, we've integrated with 45 different devices that actually bring the cost down. So when you look at our moonshot, it's not just access to care, but cost to zero. And we've done OPD sessions which are less than $1. We can do some of the diagnostics which a lab in India is going to charge you $10, and it can be done within 50 cents. Right? So we've seen that kind of transformation with technology coming with people and getting the right players together. And the most important part that we've seen is getting the right players together, is getting the right people together, getting the right infrastructure together, getting the right devices together, and the technology to make it all work.
Well, in our case, I would say that working with insurance companies, you have to deliver. And in our case, collaborating with them is basically showing that this tool and this partnership is actually working. So we measure very deeply what is the impact they're having from the collaboration. So we've seen an insurance company in Colombia that the cohorts that are using our medical advice product are using 11% less physical resources. So it's working for them, it's working for us, and it's working for the people. And another quick example is that we have around 1 million people using our platform a month. So 30% of that is actually teenagers asking about sex-related questions. So we collaborate with the United Nations Population Fund and try to fight unplanned pregnancies in our region. Why? Because we are having the users, they're having the goals to fight this problem. And basically what we're doing is delivering information and helping teenagers have a different life. So it's basically aligning the objectives and trying to do our best. And we could go on with many more examples, but basically we're just looking for alignment.
Nice. So you said 1 million monthly users. So Nilesh, I don't want to pick on you, but I've lived in India and worked in Bangladesh. And so as you mentioned these numbers, you as an organization, I know, have set a goal of 10 million patient records in a place like India, that is just so densely populated. How do you measure, or how do you set metrics for success, both for the patient populations and for yourself? I guess, how do you measure impact?
Yes.
So I'll start with you.
I think that's a great question. We keep struggling as a startup. How do we measure success for ourselves as well as our customers and our patients, right? When we look at it from a patient perspective, we're actually looking at time to intervention. So it's not just access to care, but how long did it take for us to actually intervene into the process? So if you look at every episode, that's one metric we look at. The second metric we look at is number of visits per episode. We want to bring that down. I'll give an example. When we looked at diabetic care, typically in India, it takes 3 to 4 visits before you get assessed as being a diabetic patient and get medication. We can bring that down to 2 visits, right? And that's a huge impact on one, cost for the patient, as well as the entire cost for the ecosystem. And also intervention time. It's much faster if a lot of the tests, a lot of the consultation can be done with the right experts and in the location that they are. So that's one of the metrics, 2 of the metrics that we're looking at from a patient perspective. If you ask from a CliniVantage perspective, we're very focused on number of transactions that happen on a platform. So we're one of the first companies that actually have created an end-to-end ecosystem where we've got consumer devices with the clinic solutions, so practice management solutions, EHR, PHR, OT solutions, admin, non-admin, and clinical. Everything is on a single platform, which means we only focus on number of transactions that happen on our platform. And our goal is to get to about 1 million transactions a day in the next 2 years. And we'll probably get there because the way we're approaching the problem is getting more hospitals, more clinics, and more doctors adopt to our system and process.
And how do you measure impact?
Wow, it's hard.